Under the Speaker's announced policy of January 5, 2011, the gentleman from Michigan, Mr. Benishek, is recognized for 60 minutes as the designee of the Majority Leader. The gentleman is recognized.
Thank you, Mr. Speaker. Tonight, my colleagues and myself have come to the floor, both as members of Congress and physicians, to discuss the urgent need to repeal and replace the Patient Protection and Affordable Care Act. Many of my fellow members here this evening, like many of my fellow members, I've spent the last decades of my life as a physician, a surgeon. Unlike our president, I was on the front lines of medicine. I went to medical school in Detroit, Michigan. I did a family practice internship in Flint, and I returned to Detroit to do a surgical residency, and then moved to the Upper Peninsula of Michigan, where for the last 28 years, till I took this job, I was taking care of patients in a rural general surgical practice, and I know what it's like to be in a small town where people depend on their local hospital, their local physician, and it's 2 hours in an ambulance to get to the next nearest hospital. And the Patient Protection Affordable Health Care Act is affecting rural hospitals in such a degree that many of these hospitals are going to close. And I just want to bring to your attention, Mr. Speaker, the seriousness of this problem. It's been a pleasure being a surgeon. It's been a pleasure being here in Congress. I mean, as a matter of fact, sometimes patients of mine still call the congressional office inquiring about scheduling a case. One of the very reasons I ran for Congress was because I felt those with real health care experience needed to contribute to the national discussion on health care reform. Tonight, along with other members of the Doctors Caucus, I'd like to dispel some of the myths associated with the President's health care bill. It's time to set the record straight. It isn't enough to just say this bill must be repealed. We must tell you why it has to be repealed, explain to you the really bad aspects of this bill. I'm proud to say that one of my first votes as a member of Congress was to repeal it. Tonight we're going to go through some of the provisions of the bill which make it so onerous. While I disagree with the President's health care bill for a number of reasons, I'm particularly appalled at the recent regulation issued by the United States Department of Health and Human Services as a result of the bill, requiring all employers, even if they have a religious or moral objection, to offer health insurance that includes sterilization, abortion-inducing drugs, and contraception. I offer for the record an excerpt from a letter from Bishop Sample of the Catholic Diocese of Marquette, one of my constituents. Here's a quote from Bishop Sample's letter. I quote, "In so ruling, the Obama administration has cast aside the First Amendment to the Constitution of the United States, denying to Catholics our nation's first and most fundamental freedom, that of religious liberty. And as a result, unless the rule is overturned, we Catholics will be compelled to either violate our conscience or drop health care coverage for our employees and suffer the penalties for doing so." The Obama administration's sole concession was to give our institutions 1 year to comply. We will not comply with this unjust law. People of faith cannot be made second-class citizens. End quote. Mr. Speaker, as a fellow Catholic and a physician, I agree with Bishop Sample. It's my belief that the government has no right to mandate that employers purchase health insurance for their employees in the first place. But this law is made even worse by demanding those who support life, regardless of their particular religion, provide coverage for abortion-inducing drugs. Mr. Speaker, federal conscience laws have existed since 1973 and have protected many health care providers from discrimination due to religious and moral values. Unfortunately, President Obama's health care bill contains no language protecting the conscience of health care providers. I recently co-sponsored H.R. 1179, the Respect for Rights of Conscience Act, which was introduced by my colleague Mr. Fortenberry of Nebraska. If signed into law, this bill would amend the Affordable Care Act to permit a health plan to decline coverage of specific items and services that are contrary to the religious beliefs of the sponsor of the plan without suffering consequences. While I and other members of Congress continue our efforts to repeal the President's health care plan in its entirety, bills such as H.R. 1179 are necessary while the Affordable Care Act is still law to ensure that the federal government does not mandate any American citizen to defy their own religious principles. I certainly have many other issues with the President's health care bill, but I'd like to give some time to my other colleagues here tonight a chance to speak as well.
Yeah, Mr. Speaker, will the gentleman yield for just a question? You know, the gentleman